can you take me back to that day when you first started experiencing symptoms?
With the first few days of like the illness, I felt like sort of odd. I couldn't really pinpoint what it was, but it wasn't the symptoms that we typically hear about when we hear about COVID-19, the shortness of breath, the temperature. I just felt just not myself. It was not until like the 12th of April where I started to feel really bad. I started to cough a lot, had shortness of breath, just feeling generally unwell. That started off in the day, and then towards the end of the day, I felt really unwell. I couldn't form full sentences. I felt weak. I just couldn't. I couldn't sort of like function properly. In which case, I then decided then to call emergency services. They came within sort of like 10 minutes of the phone call. They came and examined me. They did my blood pressure. They checked my saturations, which tells us how much oxygen is on the blood. They saw that they noticed that I had a high temperature as well. So they took my temperature, and that was like 38 plus at the time, which is a high temperature. And they just noted, like through observation, that I was sort of coughing and just looking very unwell. And then they decided then it's best if I go to hospital, which I did. In which case, I mean, I've got a small child, he's 12 years old. I had to call family members to come and pick him up. So I was in hospital within sort of 25 minutes from the ambulance arriving and then waiting for family. So yeah, it was quite scary actually. I mean, I was taken to A&E.
And you have a kidney condition.
Correct. Yes.
And so obviously there is a lot of concern for people who have a pre-existing health condition, because it seems that they're more at risk of contracting the virus and also experiencing the worst symptoms. So can you tell me about the treatment that you received once you went into hospital based on those things?
So when I went into hospital, I was first put in like a triage unit that was specific for people that had that were queer with COVID-19. So they took some bloods from me, and it would included FBC, so full blood count, urines, which look at the kidney, and I think another abbreviation called CRP, which checks infection markers. So they would have checked all my bloods. They did observations. That was doctors and nurses combined, and they gave me some fluids as well and some antibiotics. So those are the sort of things they initially did. And once they did that treatment, I had an X-ray as well. Just wanted to see what the lungs were doing. And from there, I was isolated in another unit, away from any other patient, because at that point they had also then tested me for COVID-19. So as a query COVID-19 patient, they had to isolate me just to make sure that I wasn't going to then infect other people. I couldn't form full sentences. I was walking to the toilet just feeling so tired. I also had loose stool as well, which I understand is another sort of symptom of COVID-19. And just being really scared, not knowing what was going to happen. And then later on, because of my kidney problems, they decided that I should be moved to a hospital that looked after my kidney. So I normally go to another hospital in Birmingham that looks after my kidney. They're familiar with me, they know me well, and they liaised with that hospital and they said it was best if I went there, in which case they can then look after the fact that look after my kidney and also treat the COVID-19 as well. So I went there sort of day one, day 1.5 of being in hospital, and I stayed there for a further 4 days.
When you had it, were you kind of expecting the worst because of your...
Yeah, definitely. I was expecting the worst. I was so scared at the time. I didn't know what was going to happen to me. To be honest with you, my kidney was the last sort of thing at the back of my mind. It was at the back of my mind, but I was more scared of, you know, with regards to the COVID-19 not surviving. And all I kept thinking about is my son, who's going to look after my son if I go. It was just a scary time for me. But, you know, I'm just glad for the NHS sort of being so supportive at the time, and the treatment that they provided was brilliant.
Even though obviously you have this kidney condition, you've managed
Mm,
to beat COVID-19. You survived it, and I guess the time that you spent in hospital is relatively short to some of the other numbers of weeks that some people can spend. So I guess your
yeah,
case, your story has been providing a bit of hope to people who are really fearful at this moment about if they
yeah,
catch it and they've got underlying health conditions. And I wondered if you could just give some, I guess, any advice you have for them. We know that some people are scared of going to hospital, going to their necessary regular appointments, because they're scared of contracting COVID-19 if they go into the hospital.
we speak about people not wanting to go to hospitals and stuff for many reasons, thinking that they're going to go to hospital and not come out because of what's going on. But that wasn't the case for me. I was really, as I say, I was really poorly, went into hospital, and I feel much better now. I feel like I'm at my sort of baseline of how I normally am. I feel like I've got more energy. I just feel great, and I don't know how I would have been if I didn't call 999. I don't know what would have happened. So it's a case of, if you do feel like you're declining at home, if you feel like you're unwell, you must contact emergency services. You must get advice from your specialist team, whether you've got diabetes and you've got a team that's associated to that, or if you've got renal problems. It's just so important not to sort of stay at home and think, oh, I don't want to get COVID going into hospital. I mean, you can use me as a prime example that, I went into hospital and I've come out, I'm okay now, I'm much better. If I didn't call emergency services at the time, I don't know where I would have been. I don't know what would have happened to me.
Can you talk a little bit about the tests? Because that's another thing I think which is there's been some scaremongering around online. What is the format of the test that you had?
So the COVID-19 test was a sort of long cotton, like a long bud that goes down the nose. Thin. It's a bit uncomfortable, but it's nothing too invasive. It's just literally takes a few minutes, and then they send that off to microbiology, and that came back within 48 hours. In which case, for my case, it was positive. But yes, it was quick. I think because I was so sick at the time, I didn't feel it. It was just something that happened, and it was quick. They gained consent, and that was that.
When it came to the time that you were discharged from hospital, what was your health like then? What was it that I guess gave you the all clear to be discharged?
When you've got infection markers, it's normally above 3, which indicates that you have got an infection. Mine was at the time probably something like a 60, and through the days, they were testing my bloods and it was going down, which is a good thing. So, and obviously in myself, I was improving as well. I was forming full sentences. I wasn't coughing as much. My temperature was stable. My blood pressure was stable. I was able to move around my bed space quite easily. To the point where I was making my own bed. I said, look, I want to make my own bed because I wanted something to do, I know. But yes, they're just looking at those type of things, and they said, actually, you're okay. But it didn't stop there. They didn't say sort of you can go home and that's it. They still want to monitor me. They want to check my bloods weekly, just to make sure that my kidney function's good as well. And I'm getting calls from the hospital just to see if I'm okay, which is brilliant. They're actually making sure they're following up my care and making sure that I am actually improving and doing well at home.
We've seen some people who were self-isolating at home with COVID-19 symptoms who have sadly passed away. And I just wondered if you could give any guidance about when people should make that call if they're experiencing symptoms.
Well, generally, I mean, we've all got different pain thresholds, and like the way we tolerate, where we're able to sort of like, when we are unwell, we kind of say to ourselves, do we need to call 999? Is it necessary? My answer to that is just, if you are getting the symptoms of COVID and it's unbearable, you need to make that decision. You need to call emergency services. So if you're coughing and you're getting temperatures and you feel really unwell, you need to make that decision and call 999, definitely. It was just me and my son, so at the time, so it was quite scary. I didn't have anyone else there but me and my child. So that made me think, I've got to do something about this, because I can't just be here at home sort of getting unwell and he's at home, because I felt as though I couldn't look after my son the way I would want to, it was literally that time I needed to call 999. And I think there's so many of us that are self-isolating on our own, without family members with us. It's a case of that you need to make that decision when you are sort of deteriorating.
Can you tell me about how challenging it is to be a nurse or a healthcare worker or someone working in a hospital at this time?
It's challenging, being on both sides. You get to see, as a patient and as a nurse, both of them are hard, being a patient and being a nurse in NHS at the moment. There's a lot of strain, uncertainty. We as nurses are looking after patients with COVID, but then obviously we're worried about ourselves and our families as well. So it's just a difficult time at the moment, but we're getting through it. We're staying positive and so forth, and we're just sort of just doing what we need to do. So yeah, it is difficult.
PPE has been a hot topic during this outbreak. Can you tell me about what kind of PPE that you're wearing when you're working and how you feel about it?
Well, yeah, we know there's a national sort of shortage or international shortage of PPE. I mean, the type of PPE I would probably wear, depending on the type of patient I'm looking after, is generally mask, surgical mask, gloves and apron. And if we are going to be dealing with sort of COVID patients, wear the shield as well. So you get fit tested for that, so to make sure that you're actually wearing the appropriate masks to suit your face. But if you're not literally dealing with any patients that are COVID patients, they're just wearing general masks at the moment, and gloves and gowns. So that's sort of meeting public health guidelines at the moment. So we're just following that, but it changes all the time. So we're just going by Public Health England guidelines.
We're now looking at reports that Black and other ethnic minorities are at a higher risk of contracting and also experiencing the more severe symptoms. And I just wondered what your, thoughts were on those kind of initial rumours, and then now looking at the data that's possibly showing that disproportionate impact.
COVID-19 it doesn't discriminate, everyone's getting it. As we've seen, even our prime ministers had COVID-19, so we know that it's not discriminating anyone. I'm not particularly au fait with the numbers in terms of how many people of colour are getting it. But I do know there is like sort of high prevalence of Black and Asians that are getting COVID-19 at the moment. But that could just be related to the fact that the more prone to these comorbidities, they've got more comorbidities within those groups.
Is there anything you'd encourage people to do to ensure that they are taking those necessary precautions and hygiene measures?
It's just a case of just following the guidelines, washing your hands, at least 20 times a day, making sure that you maintain social distancing, staying at home, not sort of meeting friends, thinking, oh, they haven't got it, they've been all right, self-isolated 14 days. You can't make these assumptions that everyone else is self-isolating and they've all go meet them. So it's just a case of just being safe as possible.
Health workers have become heroes, recognised as heroes now, and you're one of them. How do you feel about the, things like the Clap for Carers initiative, the just widespread public support that people working in the NHS are receiving at this moment?
Well, it's good. It increases morale within the NHS to show that we're being appreciated. When with the clapping as well, I mean, my close where I live in a cul-de-sac. We did the whole clapping yesterday, and we've been doing it every single week. And I come out, I sort of stand in my porch and clap. And it's brilliant because it also gives us an opportunity in my community to see who's actually okay. They all come out and we're looking around, everyone's fine, and we're sort of like, you know, saying, brilliant, this is brilliant. And it is, as I say, it just shows real good appreciation of the NHS. I'm just going to just follow the guidance of like the consultants at the hospital that looks after me, and obviously public sort of national guidelines in terms of, you know, staying at home, because I've got to stay home for 12 weeks in total, and that's what I'll be doing. But after that, if I can go back to work, I will definitely, and I can't wait. Yeah. But yeah, just enjoying being at home with my son at the moment, and just hoping this whole thing goes away soon.